And we are live. Hi, good evening, everyone. Welcome to Level Up Live. I am Dr. Sharita Gaskins-Stillette. I am your host. This is the show where we highlight the amazing accomplishments of physician women, both inside and outside of the exam room. I am super excited about tonight's guest. I can't wait to introduce her to you. But I just want to give a few minutes for others to come in. And while we wait, guess what? I lied last week. I told you guys that registration for a weekend for me was closing over the weekend. Well, the hotel decided that we should have a few more days. So registration is still open for a weekend for me, the premier wellness experience for professional women, taking place November 2nd through 5th in Puerto Rico. So if you were thinking about it and you thought you'd missed the deadline, do not despair. We've extended it through Friday. So what they tell me is that at the end of the day on Friday, the room block will close, which kind of forces me to close registration at that point. So if you want more information, check it out at www.aweekendforme.com or send me a DM. I'm happy to answer any questions, and I would love to host you in Puerto Rico. So now let's introduce our guest. So we have joining us this evening Dr. Carmen Echols. Dr. Carmen is a family medicine physician, public speaker, and author who has nurtured and educated thousands of patients during her career. Her special interest is in chronic disease prevention and management. She helps patients and their families attain generational health through patient advocacy and education. Self described as Southern rooted and West Coast cultivated, Dr. Echols moved from rural Mississippi to Oakland, California when she was 11 years old. She attended Xavier University of Louisiana for undergrad, Wayne State University School of Medicine for medical school, and Medical College of Georgia for her family medicine residency. Dr. Echols is on the board of the Georgia Academy of Family Physicians and occasionally volunteers at the Physicians Care Clinic in Decatur. Her first book, Diabetes, What Your Physician Wants You to Know But Can't Tell You in 15 Minutes, was released in December of 2022. When she enjoys life outside of medicine, you can find her cooking a gourmet meal for her husband and children, exploring the great serving and leading as a member of the Junior League of Decatur, or people watching at a local coffee shop. Welcome, Dr. Carmen.
Thank you.
Good evening. How are you?
Doing well. And yourself?
I'm well, thank you. I just want to say
Awesome.
hi. Dr. Janine is telling us hello. Good evening, Dr. Janine. Thank you for joining us. So let's just jump right in. Dr. Carmen, tell us how you came to be a physician. Did you always want to be a doctor? Tell us a little bit about your journey.
Well, I'm a science nerd by nature. I just like seeing how things work, figuring out why they work, all of that. So I had that kind of STEM oriented brain when I was younger. And I initially was torn between being a veterinarian or a physician. So for a minute, I considered veterinary medicine. I did a research program in San Francisco the summer after my freshman year of college, and I realized that I actually preferred to have human patients who could talk to me verbally in a language that I understood, who I could interact back with in a language that I understood, and just sharing with them their joys, their pains, their frustrations, their laughs. I said, okay, I'm not going to do very well having animals as patients. I prefer humans as patients. Cue medical school.
Okay. All right. And you went straight from undergrad to med school?
Whoo, yes, I plowed straight through
Okay.
full speed ahead. Undergrad, medical school, residency, and into practice.
No breaks.
None.
I like it. Okay, so tell me, you chose family medicine. How did you
Yes.
come to choose family?
Well, the humorous short story is my internal medicine mentor told me that she was going to write me only one letter of recommendation. She was going to do one for med ped, she was going to want to do one for family, and I had a very short period of time to make up my mind.
Okay.
And I said I need, because I knew I wanted to do primary care. I loved everything about everything. When I was doing my OB rotation, I'm up here after catching the baby. I'm like, oh, what are the pediatricians doing over there? And then vice versa, when I'm up there with the pediatricians during delivery, I'm like, okay, so how's mom doing?
Yeah.
With ER, I like the fast pace of it. I like the different things that I saw coming in. You kind of didn't know what you were going to get. But I found myself wanting to follow the patient home and like, okay, so did they take that advice? Did they, heaven forbid, did they die? Like what
Right.
exactly
Yeah, sure.
happened with that patient? So I'm like, okay, so it's going to be med peds or family medicine. And my mentor asked me one thing. She said, do you see yourself specializing like ever? Like I said, like ever, ever. She said, like ever, ever. I said, absolutely not. She said, save yourself a year and do family.
Okay. All right. Well, it sounds like you're the almost the Renaissance doctor. You liked it all. Which
Yes,
actually I don't hear that much. Most of the time people say I came in, they might say I came in thinking I was going to do this thing and then I did this other rotation and I fell in love with that. Or, they kind of fall in one category or the other. It's actually pretty rare for me to talk to somebody who says that they liked it all. So it's great. It's great that you found it and you liked it and you're enjoying practice, I assume.
the foot I am. And the funny thing about liking it all, when I first went to medical school, we're going to probably dig into this later. I wanted to be an endocrinologist.
Oh, okay.
But we hit pathophys. I saw those pathways. I said, oh
Oh
no,
no.
oh no, I am burnt. Crab cycle was enough.
Yes.
More pathways? I'm good.
Way too many. I agree. See, I did not entertain endocrinology, not for even 30 seconds. Absolutely not. Um, so family medicine, tell us about your practice now. Have you stayed at the same practice? Have you changed, your practice situation around at all during your career?
I've stuck with primary care like the past 12 years that I've been in practice since I graduated residency. Um, Private practice, corporate hospital based clinics. Um, if you want to call it a retail clinic with Walmart Health, though it's
Hmm.
not really a retail clinic, it retail adjacent, and
Sure.
those have been my experiences.
Okay. So now you are an author, you're also a speaker. How did you transition into doing those things?
With the help of our dear friend, Dr. Sharita, I'm sure you know who she is, Dr. Una,
Yeah.
um, and also hearing from some of my colleagues who encouraged me to pursue my passion, who said that it's cool to diagnose and treat, but as a physician, you can do more than diagnose and treat. And understanding how to tap into what I enjoy, which is going back to me talking to those patients during my research program, talking to people, teaching them, educating them, and seeing what they do with that information.
Okay. So the patient relationship itself was your for writing the book and doing the speaking.
Oh, that's a couple of things. In terms of doing the speaking, it was my passion for patient education. The book is a nod to, of course, the insurance-based system where you have to do a lot in a little bit of time and be as thorough and as complete as possible. Um, I would may talk to patients about their diabetes or their pre-diabetes, and then they will come back to me. Dr. Echols, you didn't tell me I could do XYZ. You didn't tell me I could make this dietary change. And it's like, I can only do so much in this little time. And
Sure.
I'm sure they didn't want to necessarily come back in another 2 weeks, just be like, oh, yeah, I'm sorry, I don't have time to talk to you about this diet. Well, come back in about 2 weeks. Or I didn't have time. Oh, I'm so sorry. I didn't explain the side effect of this medication. Well, you know what? If you come back in 2 weeks, I can do.
Right, right.
It was just, it was a lot. It was a lot.
Sure.
And I saw that. And I saw their frustration. And I was frustrated as a physician. So that was one leg to the public speaking and the book. My passion for education, making sure my patients understand things in a language that they get, as opposed to medical jargon, which is spoken a lot of time because I mean that's our language as
Right.
physicians.
Sure.
Um, but that's not the patient's language. We
No.
go to school how many years to learn
To learn to speak it.
medical
Right.
language? They don't know that. And I had enough patients tell me, Dr. Eccles, nobody quite explained it the way you did. I get it now.
Mm-hmm.
In terms of the book, it was a collection of patient questions slash concerns slash complaints that I got over the years that I'm like, okay, so what are the things that my patients are commonly asking, inquiring about, want to know, frustrated about? Let me put it in this book. Um, Other inspiration of the book is personal history. My own history with diabetes, my own family history of diabetes on both sides of my family.
Mm-hmm.
Those were instrumental in me writing this book and being an
Okay.
advocate for generational health.
So generational health, I like that term. It makes me think, in money or financial settings, they talk about generational wealth. So tell me what you mean when you mention generational health.
Passing down healthy eating habits, healthy living, health literacy from one generation to the next.
Yes, yes. And so why is that so important, or where do you see the shortfalls with generational health?
My own family.
Yeah.
It's just amazing. My father's side of the family, all of my aunts passed before the age of 55 due to cardiac related illnesses that were secondary to diabetes.
Mm-hmm.
And lifestyle had a lot to do with it. Social determinants of health, such as education, also had a lot to do with it as well. The majority of his family was in the Mississippi Delta, which you know
Mm-hmm.
is
Yes.
rural. And if you're Black, you're not necessarily have access to all the resources that you need to be
Right.
healthy. You may not understand all the resources you need to be healthy. And just seeing that passed along through generations.
Okay. So now, you talked about the speaking, and how you're using that. Are you speaking mostly to patients, or are you speaking to other healthcare providers to help to educate them about the additional time they may need to take, or some of the strategies? Who is your ideal audience, and how are you using your speaking?
So right now, I'm glad you mentioned my colleagues. You may have a point. But right now, my ideal audience is actually my patient base.
Hmm.
Um, Want to talk about generational health? It's the matriarchs of these households. These
Yes.
women who come in and see me. My average patient demographic, Black women between the ages of 35, and now that I've actually inherited some older patients, are probably about 75 years old. Some of them are very serious about their health and wanting to make a change. Others are just confused and don't know what to do and need some
Yeah.
help along the way. Some need a little bit more hand holding, but either
Hmm.
way it goes, they're serious. They're coming in and seeing me. They may be professional women. They may be active in their community, their church, their school, corporate, sororities.
Yeah.
And it's a lot for them. It's a lot for them.
Okay, and so you're finding that, in giving this education, it's changing people's behavior?
It is. It is. Absolutely. They're going home and telling their husbands to tighten up. They're cooking a little different at home. One thing that really gave me joy was I actually prescribed the outdoors. Yes, I do that sometimes. I know we were just talking about camping. I
Yes.
prescribed the outdoors to one of my patients. I told her, join this local group. It's a journaling group. She told me she liked to journal. She was going through a lot of stress in her
Mm,
life. And of course,
okay.
my point with that is with the diabetes, increased stress, increased cortisol levels, insulin resistance, cascade on to
Right.
diabetes. So it's like, okay, let's stop this. Let's stop this right here. Figure out a way to manage the stress, get outside. Research is now showing, I think there was a study that came out during COVID that showed up to 120 minutes of outdoor activity a week is beneficial for physical and mental health.
Yes.
So I told her, hey, here's an easy way to get this through this group of women who journals. Go check them out. And I actually put it on her visit summary. I named the
Interesting.
group and everything. I didn't expect her to do it because I'm like, who has actually followed my recommendation to go outside? Lo and behold, she sends me a portal message thanking me, saying that she joined a group of women, she enjoyed it, and she looks forward to seeing them again. I
Wow.
was so thrilled. I'm like, wow. So the first time someone actually took the prescription to go outside and they did it and they saw the benefit.
I think it's wonderful that you gave her a prescription that was not medication, that it was a lifestyle change that she could make. So tell me about this journaling group. So they journal outside or they journal and then they walk? Well, how does this work?
It's outdoor journal tour. I think I've only been to one event of theirs. They are in the Atlanta metro area, and they get women outside. They usually, not always, they do have a retreat, and the ones that I've seen, they've gone to Stone Mountain and they journal when they get there.
Oh, okay. Awesome. Well, I love that you talked about the connection between stress and diabetes, the increased cortisol and all of those things. Because a lot of people, I would say even some physicians don't necessarily recognize the impact that stress can have on the physical body and just how devastating it can be. Stress impacts every single organ system that we have. And if we can combat stress, it helps to improve our health and also increase our longevity.
Yes, it does. And I can attest to that because it's just so interesting that I was diagnosed with diabetes as a medical student. So, first of all, it was like I was quote unquote dealt a bad hand with having two parents who have type 2 diabetes. I was not obese at the time, I was overweight, but I was staying up late. I was
Yes.
stressed to the max. I was overeating. I was not sleeping. As a result, my weight went up. I know for a fact now my cortisol levels were probably high because my sleep was off, and that just cascaded me to one day I decided to, I'm like, you know what? I'm not feeling so hot. I was on a pediatric endocrinology rotation. I said, stick my finger. My blood sugar was over 400.
Wow. Well, I had well, not that kind of experience, but I had gestational diabetes during my pregnancy. And what I found was I could eat the same meal on 2 different days. But if I was on call, my sugar was never controlled on call. So I was diet controlled except on call days. And it was crazy. So even if there was nothing going on, I think just knowing that I was on call and I could get a call at any moment, and with OB, you go from 0 to 100 in,
Yes,
10 seconds easily. And so, I was like, it became very clear to me the relationship between stress and cortisol and sugar levels for
it's
sure.
amazing how that works. We don't even think about that.
Because that's not, it's really not something that I hear people telling patients very much, that they need to control their stress. I mean, same with high blood pressure, you know, heart disease, all of those things can be stress related.
Absolutely.
So I also like
Absolutely.
the fact that you did this book, because it's almost like the book is an extension of you, that you saw a need that was being unmet in the time that you were given in the exam room. And so now you can use this book as an extension to make sure that your patients get the information that they need.
Hmm.
So what has the feedback been from your patients and from those who have read the book?
They absolutely love it. They have honestly enjoyed the book. They're like, hey, this is straightforward. This is such an easy read. This is great. They're grateful for it.
Okay. And
And
so
I
what, no, go ahead.
go ahead.
No, no, you go.
No, I was even telling them, I mean, I've had some patients say, oh, well, I'm not diabetic, but I'm pre-diabetic. Get the book. Same
Yeah.
thing. I said the only difference between diabetes and pre-diabetes is a number. That's
Yes.
it. And they're like, oh, I don't have diabetes at all. How can I use the book in a way to prevent it? I said, absolutely. I have a family history. Read the book.
Yes. Yes.
I
So
say, and buy gifts and share with others.
right, right. Now, do you have other books planned?
Not at this very second. I'm just kind of taking a breather right now.
Sure. I mean, it was
But
just December, right?
yes, yes. I'm like, not even a 1 year anniversary yet.
Uh-huh. But so nothing planned right now. Are there other areas where you see a tool like this could be used?
I'll say my colleagues may not like it, but my colleagues
Uh,
could possibly share with their
yeah.
patients.
No, absolutely. I think actually your colleagues would like it. To be, I mean, I would like something like that where it's comprehensive. Again, it's a time. It saves you time, but it also gives you the comfort of knowing that you've given the information to your patient.
Right. It's like, okay, read this book, ask any questions, because if the book doesn't answer it, that's fine. I can easily answer it.
Right, right. But again, it gives them something. And people go home, they forget what you said. They can pull out the book. Now, what number did she tell me I was supposed to have? 1 hour after my meal,
Hmm.
or what kind of exercise did she say I could do? What did she say I could eat? That they have a reference. They have something right in front of them.
And that
Um,
was another reason I wrote the book too. I said, I always tease my patients. I said, look, I know what y'all do with those visit summaries. You just take it from the checkout person. Your eyes glaze. Oh, we just fold it up and stick it in your purse, never to be found again.
exactly,
And they just
exactly.
laugh at me because they know I'm right.
Right, right. But then also, for patients, you talked about how we use our language. And even if you're trying to speak
Hmm.
in their language, sometimes, when they're being hit with so much information at one time, it can be hard to absorb everything. And so I do think it's really helpful, again, to be able to have something in print that they can go back and reference. They can share with their families. I think it's wonderful.
Yes.
So tell me what the future holds. What do you have a big dream, a big plan, or a lot of little ones?
Have a lot of little ones right now. A lot of little ones right now. Still practicing clinically, more time with the family. The kids are getting older, more outdoor stuff.
So tell us about this outdoors. I know you and I were talking before we came on camera. We were talking about your weekend. Dr. Carmen is a camper, and I am not.
Officially, officially, as of what, 2 weekends ago? Yeah, something like that.
Yeah. So you've always been an outdoor enthusiast.
To one degree or another. I mean, of course, my love for the outdoors started in rural Mississippi growing up on the farm. When I moved to California, I remember this. I was in sixth grade. We did a camping trip in sixth grade. I don't know why my mother would buy a sixth grader a brand new pair of jeans for a camping trip, but never mind, she did. And I don't remember what exactly happened, but we actually had to, I think the trail kind of dropped off and we had to slide down a hill.
Oh
So I
wow.
slid down the hill in those
In
brand
your
new
brand new
jeans,
jeans.
and they were muddy. But and my mother actually, when I packed the suitcase, she said those jeans were so stiff with mud you could just stand them straight up. She said, I wanted to get mad at you. She said, but you look so happy. I didn't get mad. So I was like, oh, thanks. Because I did have fun.
Right, right.
Um, the other, I guess you could say, life experience outside was when I did research at the University of Oregon and learned that research was not my bag at all. I needed to see people. I wanted to interact with more people, not just be in a lab. And one of the research, I guess you could say, one of the guys who was in the research program with me drove cross country from Ohio. He had a national park pass and spent the night in national parks as he drove to Oregon from Ohio.
Oh, wow.
So guess what we did on weekends? We toured national parks. We
Wow.
camped. I wasn't in a tent at that time. I just did not feel comfortable. So I
Yes.
was in the car.
Okay.
I was in the car camping, but that, I guess you could say, that's when I realized spiritually how good being outside was for me. Because Eugene was like perfect. You had the beach to the west, the
Mhm.
mountains to the east, California redwoods to the south, and I enjoyed it.
So you said, tell me more. What does it do for you? You said almost like spiritually. How does it make you feel to be in the outdoors?
I guess honestly, it's an endorphin. It's a rush. It's an
Okay.
endorphin rush. And I don't even have to be, I mean, you see people doing extreme stuff in the outdoors. I do love life. I do love life. So you're
Yes.
not going to catch me doing anything extreme. but just being present and being and unplugging and being away from electricity and the hum of some sort of electrical frequency, it does a lot for me. And
Yeah.
it makes me aware, me personally. I know that other people listening may have different spiritual beliefs, and I definitely respect those as well, but it just makes me personally feel closer to the most high, the
Yes.
creator, that there is something inside plants. They're building blocks inside. Right now, fall spiders are out. Inside the web, the spider web is a masterpiece.
Mm-hmm.
I mean, there's a huge spider web in my backyard. I really want to knock that thing down, but I'm like, you know what? That's that spider's home, and it's a masterpiece, and I'm going to leave it until it's done. It's not going to bite me. It's not where the kids can run into it. It's minding its business.
Yeah. Yeah. I like that. I like that a lot. Um, so now you with your patients, um, what other areas are you helping them to improve, or what are you doing differently, I guess, than maybe some of our colleagues might be doing to help to increase that generational health?
So it's all about perspective. Going back to who I guess you could say my average patient is, i.e., kind of transcends into ideal client as far as the book and speaking and educating goes. Especially these women, because I'm a foodie. I like to cook. I like good food. I
Yes.
do. Good food is life. Um, a lot of times women are hesitant to change their diet if they're wives and mothers because they feel like everybody in the household isn't going to be on board.
Yeah.
And I grew up old school. I ate what was put in front of me, or I didn't eat.
And all.
Simple. I mean, simple as that. So, oh, my child says they don't like X, Y, Z. Have they tried X, Y, Z? Have they tried X, Y, Z in more than one way? If they haven't, I think they should.
Mm-hmm.
Make only one meal.
Yeah.
Don't make, oh, I'm going to make something for myself and then something for my husband and my kids. Make only one meal.
You say you make gourmet meals for families. Do you teach your patients about cooking?
Once again, short time, I throw out little
Uh,
cooking gems to them.
Things like what substitutions they can, things like that.
Substitutions, substitutions. One example was how to incorporate good fats into their diet.
Mm-hmm.
So, especially one lady, she had the opposite concerns that some of my patients have. She's trying to gain weight in a healthy way. And I was telling her, and she was able to do it. And now her concern was her 2-year-old. So, well, does a 2-year-old have any allergies? No. Okay. Well, how about avocado? You know what? That's my only child who loves vegetables. I think he will like avocado. I said, mash it up and try it.
Mm-hmm.
And I said, oh, do you have anybody in the family? I said, you mentioned cooking for the family. What about meatloaf? She said, I'm sure they do like meatloaf. I said, add a tablespoon of chia seeds per pound of ground beef or ground turkey or
Mm-hmm.
ground chicken. Let it sit for about 20 minutes and then make the loaf. You can substitute the chia seeds for eggs as a binder.
Mm,
So,
okay.
so things like that.
Okay. All right. So now, tell us if patients are interested, or people. Okay. So we got a couple things with you. If people are interested in having you come speak, tell me how they can do that. Let's start with that.
Sure. You can find me on social media, specifically Instagram, Facebook, LinkedIn, at sign Dr. Carmen Echols. You see my name down there. That's without the dot. Dr. Carmen Echols, all one word, without the period. Or you can visit my website at drcarmenechols.com and
Okay.
just
Now,
send me a
is
message
that
there.
the same place that they go if they want to purchase the book?
So you will go on Amazon to purchase the book.
Okay. Because again, I think patients need this, but I also think, our colleagues could benefit from it as well, as a resource. They can at least refer their patients in that direction. And then last, but certainly not least, if people are interested in seeing you for their care, where can they find you?
They can find me currently at Emory Healthcare in Stonecrest.
Okay, and that's in Georgia. So if you're
Mhm.
in the Atlanta metro area, you're looking for a primary care physician, Dr. Carmen is there and waiting to help you. So I like to end on a variation of the same question. And I told you in the beginning that I wasn't sure what I was going to ask you because I wanted to let the conversation kind of tease it out. But what I will say is if I'm a professional woman and I am looking to up level um, my family's health, if I'm interested in tapping into that generational health that we spoke about, what would you say, me as the matriarch, what's the single best thing that I can do?
Take care of yourself to the best of your ability. The trickle down effect is real.
Yeah,
And
yeah,
that's taking care of yourself physically, spiritually, and one thing that we sometimes miss is that mental health component. Therapy is not taboo.
right. Yes, and that's especially, we want to highlight that today. I think this today is World Mental Health Day, and you're right. When we talk about whole person health, we are talking mentally, physically, as well as spiritually. And there is a lot of stigma attached to seeking mental health care, but we need to destigmatize it because it is so prevalent, and especially given the way that our society is structured right now. I was actually listening to a podcast yesterday, and the person was talking about mental health and how younger people, children, are having issues with mental health, and some of it tied to the fact that they don't get enough outdoor play. And I thought that was really interesting because, when we were kids, I don't know, I'm probably a little older bit than you, but when we were kids, we ran around and played outside all day,
You sure
uh,
did.
all day long. And
No
now,
problem.
right, and now these kids don't go out a lot. They're inside on devices and they're not getting their vitamin D. It's something about the person was saying in the brain development happens during that play. They mentioned that all animals play. Like if you look at puppies, if you look at chimpanzees or whatever, all little things play that it helps to form our brains, and that our children are missing out on that. So as part of you talk about being outdoors, and we're talking about mental health
Mhm.
in terms of that. It's important that we get outside and move around and be in nature.
Absolutely. I said, especially with the time getting, well, the days getting a little bit shorter, darkness is being a little bit longer. You're not going to get as much vitamin D in some places. Seasonal affective disorder is a real thing.
Yes, absolutely, absolutely. So all that to say, if you feel like you're struggling with your mental health, please don't be ashamed. There's nothing to be ashamed of. There's nothing to avoid getting help with. There is help that's available. Talk to your primary care physician, or seek local care. And especially if you're thinking of hurting yourself or anyone else, you want emergency medical care. So I think
Absolutely.
that's it for this evening. Thank you so much for coming on and
You're
sharing
welcome.
your
No problem.
information with us. Again, I love what you do. I especially, like that you saw a need and created a resource that is, a real blessing to your patients as well as the world in general and your colleagues, right?
Yeah.
I know I keep putting that in there, and your colleagues. So but thank you again for coming on and sharing with us and inspiring us to see a situation and affect change. I love
Sure.
that. Thank you guys for joining us tonight. Dr. Jadine, we love that you love generational health also. um, and again, registration is open for a couple more days for a weekend for me, the premier wellness experience for professional women. It is going to be phenomenal. We're going to, take a step back. Dr. Carmen was talking about camping and how it is, so fulfilling to be away. And that's what this is. There's a saying that I use sometimes that sometimes we have to unplug to recharge. And that's what this is. This is a time to get away from everything and everybody, from all of your normal responsibilities, so that you have time to focus just on you and what you need so that you can recharge and build yourself up and come back ready to seek the best version of yourself in your life. So if you are interested, you don't want to miss. If you're interested in doing those things, you don't want to miss this. www.aweekendforme.com. The dates again are November 2nd through 5th. I would love to host you there. Take care. Have a wonderful night. Thank you again, Dr. Carmen.
Thank you.